Anytime a child gets sick, it's a nervous time for their parent or guardian.
So it's impressive that our little ones are saying, hey, I need help.
This is something new, it's something different, but it is still highly efficacious and effective.
Schools have taken a much bigger role in providing mental health counselors, licensed clinical social workers.
I think it's a huge piece of the puzzle.
Schools are now providing access to doctors and therapists before, during, and after the school day. And it's all thanks to this.
We have realized that our students need a little bit more support. So with their physical health and their mental health. I am Haley Poland, Assistant Superintendent for Roanoke City Public Schools. We realized there were some barriers for our families with transportation. There were some waiting lists for mental health services. So we needed to bridge that gap, and we needed to provide services to our families so that they don't have to take off work, or they don't have to get to the school to get their child to take them to a sick child appointment, right? We want to keep our students in school the most we can.
So tell me, what other plans do you guys have for the remainder of the day?
The Kent family agreed to do a therapy session for us so we could show you how it works.
I'm sure you're going to be okay, and even if you do get in trouble a couple times, it's not the end of the world.
I agree. And fifth grade can be kind of difficult, right? A little bit.
Talk to me about how it felt talking to somebody on the computer like that.
It was cool because I could tell them the first day of school, it's kind of nervous to go in, but then when you get the hang of it, it's just kind of gets you in the mood just to go into a new classroom.
So she helped you feel more comfortable before the start of school? And how about you, Olivia?
It was definitely pretty cool how that works. I like how kids will be able to communicate with people like that without traveling long distances, but you can just grab a device and you can talk about whatever you want.
It's another way to help kids, just cope with school, grow up, and realize that, things that they may be going through, other people may be going through, and there's a way to talk that out.
The data is pretty clear. 50% of mental health conditions or disorders start before the age of 14. 75% start before the age of 24. And maybe the most staggering statistic is that the average in this nation from onset to treatment for mental health care is 11 years. I am Andrew Post. I'm the president of Hazel Health.
What kinds of things are you seeing in school systems that are using this?
Number one, we are seeing care much earlier. And so I say that because 45% of our visits are in the elementary grade levels. And honestly, as somebody who spent a decade and a half in public education, I was surprised to see that.
Roanoke students did more than 600 therapy sessions through Hazel, and those students went to 25 different schools.
Counseling is my background, so as a counselor, I see the need, and they're worried about themselves, they're worried about their friends. So it's really amazing that we were able to respond and give our students what they're asking for.
How's it working?
It's been great. It's been a great reception from our students and from our families. There are numerous languages that are spoken from the therapists from Hazel.
So how does it work? Anyone can make a referral. A teacher, school staff member, principal, parent, even the child in some states. And then Hazel takes it from there. Parents, you have to make sure you've given consent for a physical or mental health visit. And then Hazel will set appointments, or your child can go to the school nurse when they're not feeling well and get seen by a doctor.
Many of the common things that a child will come to a school nurse for, a bellyache, a headache, a scrape or a bruise from a fall, are things that the school nurse can take a look at, triage, and then say, hey, you may benefit from talking to one of the Hazel Health providers. And they initiate a visit. The provider will come on and do a full assessment.
The telehealth option can save parents time and money and help kids with chronic issues like asthma.
When a child has an issue at school, one of the first calls that are made are to the parent. And the parent is left with trying to make the decision of, do I take off from work to pick up my kid? Do they need to be taken home? Do they need to be taken to the doctor? Are they going to be able to get an immediate appointment to address their needs?
This is removing so many barriers. You have a cost barrier, you have a transportation barrier, you have a language barrier sometimes. How important is that to make sure that this is accessible for everybody?
It's huge. Sometimes the parents are struggling just to get transportation to work. So removing that barrier for them to be able to get their child therapy is huge, and especially when we're talking about insurances and maybe they're only approved for 6 sessions, or maybe there's a wait list.
As a pediatrician, what are some of the concerns that parents might have regarding this in the school setting?
This is relatively new. Telehealth and virtual health platforms were not something that were widely used and standardized practice before COVID. And so many parents grew up in a generation where they're used to going to the traditional brick and mortar pediatrician's office. The parents do have the opportunity to join the visit if they would like. And even if they don't join the visit, they will get a follow-up detailed description of what brought the child in and the treatment plan.
Are there limitations with this?
There are. All of our students, they can access it through any type of device that connects to the internet. But sometimes that is still a struggle, right? They may, especially over the summer, they turn their laptops in. Developmentally, sometimes even our little ones or students with developmental needs, it may not be the perfect platform for them. They may need in-person therapy.
It limits the scope of, the depth of a physical exam. So you're relying on what you're seeing on camera and different views and angles there. But certainly for some conditions, it makes it a little bit trickier if you've got to actually feel and palpate a particular area.
The reality is that schools also have to educate children those full 7 hours of the day. They have a full schedule, and so pulling a child from class to go onto the iPad and talk to their licensed counselor, can be a barrier at times. Unfortunately, so too can chronic absenteeism. The reality that if we have a visit scheduled, while we can shift it from a school-based to a home-based, when the child is absent from school, unfortunately, the miss rate for these sessions becomes much higher.
We are focused on academics, but we are also focused on our whole child, and so we want to make sure even if they're struggling at school, there's something getting in the way. So if this is a way that we can support our students to be able to access their instruction and make sure that they're their best self when they walk into that classroom, this is truly what Hazel is for.
The convenience can't be underestimated. We all have devices now, and this just opens up a whole new opportunity for all the kids and their parents to have another professional in the house to kind of help us navigate raising these kids.
Hazel will help connect students to in-person providers when there's a need, and all of this is completely free for students, even during the summer.
Be sure to subscribe to Solutionaries to see all our latest videos right here on YouTube.